This presentation is a brief overview of the Pinnacle Points of History for the health education and promotion profession between the years 1900 and 1950.
The early part of the 20th century was known as the reform phase of public health. Federal regulations were passed to address poor conditions in which people lived and worked, as more and more of the U.S. population was moving from rural farming towns to the industrialized larger cities. In addition, during this time, the first voluntary health advocacy organizations were formed to address the needs and wants of specific disease groups such as tuberculosis, cancer, and the Red Cross. The creation of these organizations provided an early foundation for the large health advocacy and disease research, prevention, and education organizations that we have today. In 1922, the Public Health Education section of the American Public Health Association was founded, to which most public health education specialists belong. It is now known as the Public Health Education and Health Promotion section of the APHA. The Public Health Education section set the stage for the robust health education and promotion mission and standards we currently have. By the time we reached 1930, lifespans had increased by 10 years as a result of the public health improvements made to sanitation and healthcare in the early part of the century. This gave rise to rapid population growth. At the same time that our demographics were changing, the stock market crash of 1929 led America into the Great Depression. The resulting Social Security Act of 1935 was a landmark act because of its financial support for state health departments and facilities and efforts to improve child and maternal health. It also laid the groundwork for future public health and welfare programs aimed to support the needs of the elderly and disabled. During this time, in an effort to provide for improved coordination of public health, we see legislation passed through the Ransdell Act of 1930 that created the National Institute of Health, now called the National Institutes of Health, which aims to improve the health of the nation through leadership in research and programs that address the causes, prevention, diagnosis, and cures of diseases, as well as research and understanding in human growth and development, mental health, environmental contamination, and provide for the collection and dissemination of medical education. In 1946, we see the creation of the Centers for Disease Control and Prevention, which originally was called the Communicable Disease Center. The CDC was created first and foremost to protect the health of the American people with a very specific task at hand, to stop and prevent the spread of malaria across the country. The original leaders of the CDC had the foresight and vision to focus their attention on the surveillance of communicable diseases, in addition to offering their services to the state's public health departments when needed. The implications of the creation of these two agencies are tremendously significant to those involved in health education and promotion at all levels. It allows for those working in voluntary organizations to advocate to those public health education and promotion experts in government agencies for research. It allows for advocacy to Congress for better funding to those agencies. And it allows for better dissemination of information back to the public and those impacted by disease or disability. 1900 to 1930s school health. Health education from 1900 to 1920 was generally characterized by inconsistency and awkward progress. World War I provided the momentum and enthusiasm for widespread acceptance of school health education as a discipline. This is because 29% of the men examined as potential military draftees during World War I were rejected on physical grounds. A large portion of these physical deficiencies could have been prevented if schools had been doing their part to train children concerning health and fitness. In the immediate post-war years, 16 states required hygiene instruction in their public schools. 12 of these states made requirements for the preparation of health teachers in schools supported by the state. Around the turn of the century, the role and advantages of school nurses began to be recognized. In 1902, Lillian Wall demonstrated in New York City that nurses working in schools could reduce absenteeism due to contagious diseases by 50% in a matter of weeks. For minor conditions, nurses treated students in school and instructed them in self-care. For major illnesses, nurses visited the homes of children who had been excluded from school because of illness or infection, educated parents on their child's condition, and provided information on available medical and financial resources, and urged parents to have their children treated and return to school. School nurses began to assume a major role in the daily medical inspection of students, treatment of minor conditions, and referral of major problems to physicians. This expansion of the role of school nurses freed physicians to spend more time in conducting medical inspections of individual students with recognized needs rather than inspecting entire classes.
In looking at school health during the mid-1900s, there are three major developments that can be seen. The first development we are going to focus on is the official recognition of school health education. School health education, which had been previously associated with physical education, received official recognition in 1937. This occurred when the American Physical Education Association became the American Association for Health and Physical Education. The second major development that should be noted was the creation of the American School Health Association. Originally, this organization was founded as the American Association of School Physicians in October of 1927. After its founding, the American Association of School Physicians grew so rapidly that in 1936, membership was open to all professionals who had an interest in promoting school health. This led to the official rebranding of the organization as the American School Health Association in 1938. Today, the ASHA is still an active organization whose mission is to transform all schools into places where every student learns and thrives. The American School Health Association envisions healthy students who learn and achieve in safe and healthy environments, nurtured by caring adults functioning within coordinated school and community support systems. The third major development within the area of school health for the mid-1900s was the creation of the School Health Section of the American Public Health Association. Historically, the American Public Health Association has shown interest in and support of school health. In fact, when looking at the earliest supporters of health education in schools, it can be seen that many of them had been leaders in public health. This interest led to the creation of a separate section within the administrative structure of the APHA in 1942. This new section was named the School Health Section of the APHA, and its sole focus was on school health interests. Currently, the School Health Section of the APHA operates under the title School Health Education and Services Section. Members share, discuss, debate, and work to improve early childhood, K-12, and college health through effective practices and research. As we round out the first half of the 20th century, we see that the efforts of public and school health education and promotion professionals, in conjunction with improved medical and immunization services, are paying off, as many communicable diseases are no longer the major threat to public health. As we enter the second half of the 20th century, we begin to see a shift into the prevention of chronic disease, which remains at the core of health education programming we see today. That concludes this presentation. Thank you.